Hello everyone, it's Rayan Medical, and today we're gonna talk about the anatomy of the mediastinum. First, let's talk about the mediastinum. What is the mediastinum? So basically, it's the space inside the thoracic cavity between the two lungs. So it's right about there. Here is the rib cage or the thoracic cavity. It's in the middle between the two lungs. So, the lungs are here and here. So it's just the space in between the two lungs. Let's talk about the boundaries. Where does the mediastinum end? So these terms it's so important. You need to know them, the terminology. So anterior means in front, posterior means behind, and superior means on top, inferior means below, and the sides self-explanatory. So the ending of the mediastinum in front is the sternum, or the thigh bone. You can call it the thigh bone, which is the frontal part of the rib cage. Behind the mediastinum, there is the vertebral column. It's called the vertebral column because it holds the cervical, thoracic, lumbar, sacral, and finally coccygeal. So, but what we're talking about here is the boundaries of the mediastinum. So posteriorly, there is the vertebral column. On top, there is the thoracic inlet, which is the place where the veins and arteries and stuff like that enters through the thoracic inlet. It's like a place that holds these together. Inferiorly or down below, there's the diaphragm, and on the sides there are the lungs. So these are the boundaries of the mediastinum. So as we said, the anterior leads the sternum. It's the thigh bone, somewhere like here. It's in front of the rib cage. However, posteriorly there is the vertebral column, as we told, the the cervical, thoracic, lumbar, sacrum, and coccyx. On top, there is the thoracic inlet, which is these two areas that veins and arteries enters from here, and on the sides there is the inferiorly there is the diaphragm, which is this kind of chunk of meat, and on the sides there are the lungs. Now let's talk about the sternal angle, or the angle of Lewis. The sternal angle is right here. Before I continue, there is three things that you need to know. The sternum is separated into three parts: manubrium, body, xiphoid process. So the angle of Lewis, or the sternal angle, there is a imaginary plane that we drew here. The sternal angle ends in the manubrium, or the boundary, the imaginary boundary, imaginary plane, ends in the manubrium in front, and on the back, posteriorly, it ends at the fourth thoracic vertebra. Why did we use this plane, or put it? It's because to separate the mediastinum into two parts, superior and inferior, so top and bottom. So there are the divisions of the mediastinum. It is divided by the imaginary line we drew at the angle of Lewis into superior mediastinum and inferior mediastinum. For the inferior mediastinum, it's also separated into three parts: anterior, in front, middle, and finally posterior on the back. Here is the diagram. So this is the line right here. Here is the superior mediastinum, and below there is the inferior mediastinum, which is separated into anterior in front, middle, which is this area right here, and posterior on the back, which is this area right here. Let's talk about the boundaries of the superior mediastinum. Again, there is anterior. These terminologies are so important again. There is the anterior, which is in front. There is the manubrium, as we said, because it is separated by the manubrium. The boundaries ends in the manubrium of the sternum. And on the back, the upper four thoracic vertebra. As we said before, it says ends in the imaginary plane, ends in the fourth thoracic vertebra. Superiorly, and on top, there is the plane of thoracic inlet, which is the place where veins and arteries enter. Inferiorly, at the bottom, there is the imaginary plane that we saw before, passing through the sternal angle, the angle of Lewis, which is in the manubrium. Sides, there is the mediastinal flora, or some two sets of membranes that act to protect the superior mediastinum. So, here is the figure again. Anteriorly, we have the manubrium of the sternum. So here is the imaginary plane. Here is the manubrium of the sternum. Posteriorly, we have the four thoracic vertebra, 1, 2, 3, and 4. At the superior, we have the inlet, which is somewhere right there that veins and arteries enter. Inferiorly, which is at the bottom, there is the imaginary plane, because there is nothing else. And on the sides, there is the pleura, which, as we said, it's membranes for protection. What are the contents of the superior mediastinum? What is inside? So, first of all, we have muscles. The origin of the sternohyoid, sternothyroid, and lower ends of longus collide. These muscles are all on the neck of the body. There are arteries, the arch of aorta, brachiocephalic artery, left common carotid artery, and left subclavian artery. Here is the aorta. The aorta, because we're talking superiorly of the mediastinum, so it's the top part. There is the arch of the aorta, which is this thing. The brachiocephalic artery, which is this one. And only the left common carotid artery and the left subclavian artery. Why is this? Because the right common carotid artery and the right subclavian artery goes to the part where the lung used to be. So these are not on the boundaries that is between the lungs, so this doesn't count. More contents of the superior mediastinum. There are more stuff. There are the veins, right and left brachiocephalic veins, upper half of superior vena cava and left superior intercostal vein. So in this figure right here, we can see the right and left brachiocephalic veins. There is the right, and here is the left, the right, and this is the superior vena cava. The upper half of it is on the superior mediastinum, and the left superior intercostal vein. There are also nerves, vagus, phrenic, cardiac nerves of both sides, and left recurrent laryngeal nerve. More contents, there are more. There are the lymph nodes and lymphoid tissue. Thymus gland is part of the superior mediastinum. thoracic duct, paratracheal, brachiocephalic and tracheobronchial lymph nodes. And this figure, you can see the thymus right here. You can see the thoracic duct right here. Part of it is on the superior mediastinum, which is the upper part. And there's the brachiocephalic and tracheobronchial lymph nodes and the paratracheal. Of course, there are also tubes on the superior mediastinum, the trachea, and the esophagus. These are parts of the superior mediastinum. Now let's talk about the boundaries of the anterior mediastinum. And where is the anterior mediastinum? It's on the inferior part of the mediastinum. So anteriorly, there is in front of the anterior mediastinum, there is the body of sternum. On the back, there is the pericardium. On top, there is the imaginary plane, which is because it's the anterior mediastinum. And inferiorly, at the bottom, there is the diaphragm. And on the sides, there is the mediastinal pleura. Here is the imaginary line. Anteriorly, this is the anterior mediastinum, which is this part right here. And anterior of the anterior mediastinum, there's the body of the sternum. Posterior, there is the pericardium, which is the cover of the heart. On top, there's the imaginary plane. On the bottom, there's the diaphragm. And on the sides, there is the mediastinal pleura. What are the contents of the anterior mediastinum, you might say? There is the sternopericardial ligaments, 2 to 3 lymph nodes with lymphatics, small mediastinal branches of internal thoracic artery, and only the lowest part of the thymus and an areolar tissue. So here is the imaginary plane. The lower part of the thymus is on the it's one of the contents of the anterior mediastinum. The small mediastinal branches of internal thoracic artery. Here is the thoracic artery. Only the parts where the down part of it is on the anterior mediastinum. Now let's talk about the contents of the middle mediastinum. For the middle mediastinum, there is the heart with its pericardium. You can see the heart is on the left side of the rib cage or something like that. It's in the middle mediastinum, which is the part of the inferior mediastinum. So the heart with its pericardium is on the middle mediastinum. Arteries, there is also arteries, the ascending aorta, pulmonary trunk, and 2 pulmonary arteries. Veins, lower half of superior vena cava, terminal part of azygous vein, right and left pulmonary veins. There are also nerves, phrenic and deep cardiac plexus. There are also lymph nodes, the tracheobronchial nodes, and tubes. The trachea, at the bottom of it separates into 2 parts. So there's a bifurcation of trachea with 2 principal bronchi. Now let's talk about the boundaries of posterior mediastinum, which is on the back of the inferior mediastinum. Anteriorly, there is the pericardium and bifurcation of trachea, the 2 parts that I said. Pulmonary vessels and posterior part of diaphragm. Posteriorly of the posterior mediastinum, there is the lower 8 thoracic vertebra with intervertebral disc. On the sides, there is the mediastinal pleura. As we can see here, the figure, there is the imaginary plane, And here is the posterior mediastinum. Posterior of it, there is the lower 8 thoracic vertebra. Anteriorly, which is in front, there is the pericardium, bifurcation of trachea, because the trachea moves right there, and the bifurcation gives in the front right there, like this. And on the side, there is the mediastinal pleura. What are the contents of the posterior mediastinum? The contents, there are arteries, of course, descending thoracic aorta and its branches. Why it's descending? Because it's on the posterior. Veins, azygous vein and hemiazygous vein, accessory hemiazygous vein. The nerves, there is the two vagus nerves, greater and lesser, and least flanking nerves. For the lymph nodes and lymphatics, there is the posterior mediastinal lymph node alongside the aorta and thoracic duct. So the aorta is on the posterior mediastinum, which is inferior part of the inferior mediastinum, and the tube, there is only the esophagus, because the trachea, it's only the bifurcation of it, not the actual trachea. The esophagus goes posteriorly. Trachea is a tube, but it's not. It doesn't go posterior. It goes superiorly. And finally, I can thank you for listening. Hope you like this video. I hope it was beneficial to you. And please leave a like, share this, and I'll see you later.